Hello everyone, this is Dr. Nate from Back to Health, and we're going to be talking about ergonomics and risk management. The question really becomes, why practice good ergonomic habits? And really because it's one of the main reasons we see people coming into our clinic for neck and back pain. It's related to the back, ultimately to the way they are performing common daily activities. Poor movement patterns will lead to a predictable pattern of injury to the spine and ultimately lead you into things like back pain, neck pain, stiffness, that kind of stuff. If I as a doctor were only to treat the pain itself without really addressing or helping you address the underlying source of the problem, that being your poor movement patterns, you're surely going to end up back at my clinic at some point in the not too distant future with the same reoccurrence of symptoms that you had when you originally came in. And while I can't guarantee you that if you practice good ergonomic habits, you're not going to have any neck or back pain, it will definitely help you dramatically decrease the risk of a relapse of your condition. Let's talk a little bit about your core. Your core muscles are the muscles that surround your spine and your pelvis. They are what give stability to your spine, and they're important to always activate your core before doing a movement in your daily activity. So before bending or twisting or picking up groceries, whatever the situation is, you want to try to activate your core. And it's definitely a learned habit. I'll show you how to activate your core. Go ahead with me now. I want you to sit up nice and straight. Put your hands on your tummy, right around your belly button area, and I want you to just give a good cough. Did you feel those muscles that contracted real deep in your abdomen? That is your core. This time we're going to redo it here. I want you to actually cough, but I want you to try to hold that contraction and see how long you can hold it, 10, 20, 30 seconds, whatever you can do. Sit up nice and tall, put your hands over your belly button, give a good cough, and try to hold those muscles. Yeah, it takes a little bit of brain work there. You got to do a little bit of focus on contracting those muscles. That is your core, and that's what you want to do. You want to activate your core prior to doing any movement in your normal daily activities like bending, lifting, twisting, anything like that. The next thing I want to talk about with you are the basics of how to bend properly.
Health, and today I'm going to cover with you some basics on how to bend properly and use some good techniques to avoid creating injury in your lower back. Let's get started by taking a look at the spine here. And if we look at the spine, we should see that the spine from the front view is nice and straight. But if we look at somebody from the side, and we look at our spine from the side, we should notice that we've got this curvature in our lower back, and it's called a lumbar lordosis. So if we look a little closer here, you can see that nice backwards C-shaped curvature here in the lower back. So out here would be your belly, and here would be your backside, and we've got that nice curvature. The real trick to bending properly and protecting your back from injury is to always maintaining this curvature in your lower back at all times through the bending movement. The very second that you break this curvature and have it go the other direction, okay, you're drastically increasing the pressure on the spine and increasing the risk of injury down there. So if you've ever heard anybody say, always bend at your knees, never bend at your waist, part of the reason for that is because that helps you maintain that curvature. So you can see I have that nice curvature in my lower back as I stand here. And if I bend at the waist, the first thing that happens is my back rounds out, the curvature goes the other direction, and I increase the risk of injury on my lower back. Now if you bend at the knees, it's much easier for you to keep that good curvature in your lower back. But if you're not paying attention, you can still round your lower back out, increasing the pressure on that lower back and the susceptibility to injury. So yes, you always want to bend at the knees, not at the lower back, but what's even more important to you is to always be thinking about that good curvature in your lower back and maintaining it through the entire bending movement. So here's a couple of tips for you for a good proper bending technique. In the upper half of your body, you always want to keep your shoulders back and your chest out. In the lower half of your body, we always want to keep our butt out, and we want to drop our belly button towards the ground. So butt out, belly button towards the ground, shoulders back, chest out. This is a proper bending movement, all the way up, all the way down, maintaining that good curvature in your lower back. Now, if this is the first time you've used proper bending technique, what you're doing is you're transmitting all the forces that you normally have been putting into your lower back, and you're putting them into your hips and into your thighs where they belong. But if you're not used to doing that, you may actually feel very weak and very shaky. And I want you to practice without picking up any weight, Just practice good, healthy bending techniques as you go down to the ground and just do some squats until you feel like your legs start getting strong enough that you can bend properly. Another trick that I give patients to think about during a proper bending movement is to imagine that you have a string attached from your sternum to your belly button. The real trick during the bending movement is always keeping that string as long as you possibly can. The second you do anything to shorten that string, you're increasing the pressure on your lower back, and you're increasing the loads and increasing the risk of injury. So again, a proper bending technique, we keep our shoulders back, chest out, lower back, butt out, and always drop your belly button down towards the ground. Keep that string as long as possible during the entire bending movement. The second you do anything to shorten that string, you've got problems going on in your lower back, and you're going to get yourself hurt. So again, if you have any questions or concerns about proper bending technique, I'll happily go over these with you in person during your next office visit. Don't hesitate to ask me, and enjoy the rest of the show.
Basic lifting tips here. Anytime you step up to an object to move it, you want to assess the load. And what I mean by that is check the object you're about to lift before doing so. Kick it with your feet a little bit, shuffle it with your feet, move it with your hands, just to try to get a rough assessment of how heavy something is. Is the object packaged properly? Check for things like uneven distribution of weight. Is it heavy at one side and really light on the other? Check for items that may shift during the lifting process. Look at the cardboard. If it's in a cardboard box, assess the box that it's in. Is the box sturdy? Does it have handles? Are there tears in the box? Does it look like maybe the bottom could fall out of the box when you pick it up? You always want to assess your load before you pick it up to make sure that it's safe to lift it. The next tip is to, when you are carrying objects, always carry them as close to your center of gravity as possible. So carry them as close to your chest or your belly button as you possibly can. Here's an example with a 20-pound bag of flour, pure physics. If you take that bag of flour and you extend it out away from the body, it dramatically increases the compressive force on the lower back. Likewise, the closer you carry that object to your stomach or to your belly button, the less compressive force that you're going to have on the lower back. The next question I get from patients is, how did I hurt my back shoveling snow? Is there a safe way to shovel snow? Well, the safest way to shovel snow is to avoid combining movements like bending and twisting at the same time. So, if I'm standing looking, let's say, east, and I want to set something down in the direction of north, I don't want to stand with my feet facing east and just twist my whole entire body to move the load all in one movement. That combination of movements, the twisting and the bending at the same time, dramatically increase the susceptibility of injury for your lower back. Instead, here I am facing east and I want to set my object down north. I bend to the east, I pick it up, I turn my body, and then I set the object down facing north. So essentially, it seems kind of robotic-like, but these movements of breaking down into single planar movements will definitely save your lower back versus combining movements like bending, lifting, and twisting at the same time. For awkward areas to get into, like the trunk of a car, there are some alternative bending strategies. Again, it all goes back to maintaining that good curvature in your lower back. So, the one knee bend or the cantilever bend, they can definitely help you to get into some awkward spaces. But again, we try to maintain that curvature in the lower back here. Big question I get for patients is sleeping positions. And in sleeping positions, these are two of my favorite, side sleeping and back sleeping. And I see we've got issues here. I'm going to change this over to back sleeping right now. In the back sleeping position, what I like to see is I like to have pillows up underneath the knees, just to put a little bend in the knees here. It takes some pressure off the sciatic nerve and helps maintain that lordosis or curvature in the lower back while you're sleeping, and with some good support underneath the neck. For side sleeping, what you're going to see is knees stacked one on top of each other with a pillow in between the knees. These body pillows are really nice because you can even have a little bit of a rest here for your arm as well. It's a great position, again, keeping good support underneath the neck. Patients will ask me things, they'll say like, is it better to sleep in a hard bed or a soft bed? And what I'll tell you is, honestly, it really doesn't matter. Generally speaking, you don't want anything at either extreme. You don't want anything that is too hard or anything that's too soft. Patients ask me what's the best mattress. The best feedback I get from clients, they seem to be happy with their Sleep Number beds. I know that with those, especially if you have a spouse, he likes it a little harder, a little softer. You can adjust them side to side to get a more customized sleeping experience. Let's talk about choosing a pillow. If you're back sleeping, the orthopedic pillows can be nice. We call them the dippy pillows, because they help support the spine in its normal curvature. They're very good. However, if you're side sleeping, they're not good, because you don't want a dippy pillow because your head will kind of fall into it when you're laying on your side. When you're side sleeping and you're selecting a pillow, the only thing you need to pay attention to is making sure that your spine is nice and straight during sleep. So here, if you have a pillow that's too big, you can see how it kind of bends your neck up, and you don't want that. Likewise over here, if the pillow is too thin, you can see it kind of bends the neck over, and you'll wake up with a stiff neck as well. So if you've got that pillow that you've had since you were 5 years old and it has virtually no feathers left in it anymore, it's certainly a reason that you're waking up with some neck pain or some neck stiffness in there. Let's talk about getting up from a lying position. And the biggest thing that you want to do with this is you want to avoid sit-up-like movements. So let's say I'm adjusting you on my table and you're laying on your back and I'm working on your neck. I say, okay, Mrs. Jones, go ahead and get up. You're all set to go. I don't want to see you doing a sit-up movement, okay? What you want to do is you want to go from your back, you want to roll onto your side, and then push yourself up in that direction. A much safer way to get up from a lying position. The next thing is sitting in a chair. First of all, I must say that sitting is probably one of the single worst things you can do for your back and for your overall health. And it's something that we all do every day, but it's just really not good for you there. Just Google health concerns of sitting, and you'll find all the studies out there about how for every 3 hours that you sit, you decrease your life expectancy by 20 minutes and things like that. Go ahead and look those up. They're pretty interesting papers. But if you do have to sit, one of the things that you want to do is make sure that you're slightly reclined, just a little bit in the chair. And then also make sure that you have a really good lumbar support. So again, we talk about maintaining that nice lordosis or that nice curvature in the lower back. Here's that lower back support doing that. They work very well. The other side of the coin here, you can see without the support, you kind of straighten that curvature out, take it the other direction, and it certainly causes a lot of problems. Another great thing to do just for general comfort, also in a reclined position, is to have a small tilted footstool here. If you're sitting for long hours of the day, it's a great thing to do. Really, I advise patients, if they can, every hour getting up out of a chair, walking around for at least 2 or 3 minutes, trying not to sit by all means possible for anything longer than 2 hours at a time. Let's talk about some computer ergonomics. Again, the de-evolution of man here. We all spend time as slaves to our computers. Some things that can help you out. Again, we see the tilted footstool. We see a slightly reclined seat back angle. We've got good lumbar support in here. Keyboard roughly at the level of the elbow. One of the most important things that I see here is keeping that screen level with the eyes and having some type of a workstation here where you can put papers, like if you're typing papers or spreadsheets, keeping them up elevated right at eye level so that you're not bending the head down constantly looking down is very important. One of the things to pay attention to when you're working on a computer is avoiding what I call the tractor beam effect. So what that means is that the computer screen seems to be like a tractor beam, and it like pulls your head into the screen. And the reason you want to do that is because this up here is your head, and it sits balanced on top of these 7 little bones in your neck here, and it weighs about 12 to 14 pounds. So in proper alignment, it doesn't exert too much force, maybe 12 pounds of pressure on the spine. But as that head starts going forward, you can see we start increasing the amount of pressure on the neck and on the muscles of the back of the neck. And this can cause all kinds of neck pains and problems. So always try to keep your head back over top of your shoulders and avoid that tractor beam of that screen pulling your head forward. Speaking of which, we have text neck, and this is a new phenomenon. I would say within the last maybe 5 years of practice I've seen this, What's alarming to me is how many teenagers I see coming in with this. And what I mean by that is they've got their necks are just tight, they've got headaches, they're stiff, and really it's an end result of text messaging or looking at our phones all the time. And it's something that we all do. I'm guilty of it myself, but certainly better than looking down at your phone all day long is to raise your phone up to look at it more eye level. This was a study that was done here. Again, you can see at 0 degrees with the head over top the shoulders, the head weighs about 12 pounds. 15 degrees of flexion, 27 pounds. 30 degrees, 40 pounds, 49, and ultimately 60 pounds of pressure from staring at your smartphone all day long. It's a big workout for those very delicate, tiny neck muscles. And, I could do chiropractic on you till the cows come home, but really if you're doing this all day long, you're going to have neck strain and neck pain. There's just no way around it. Let's talk about going from sitting to standing. Again, up here in the upper left, we can see this is the incorrect method for going about it. We break that curvature, the good curvature in the back. That is incorrect. Instead, what we want to do is we want to shift towards the front of our chair, stand up vertically, and then we can walk away. When we combine this with getting in and out of the car, same thing. We talked about shoveling snow, which is avoid bending and twisting at the same time. It looks a little bit like a robot, but you've turned and face away from your car, you back in, you take a seat, and then you rotate around in your chair. Likewise, when you get out, you rotate around first, stand up straight, and maintain that good lordosis or that good curvature in your lower back. Prolonged standing. Again, the important thing with prolonged standing is maintaining that good curvature in your lower back. And one of the things that can help you do that is using a small footstool and resting one of your feet up on that. So you can see here doing dishes, bending at the waist, reversing the curvature, bad. If we use a little bit of a footrest, we can see it's easier for us to keep our shoulders back and to maintain that good curvature in the lower back. Carrying luggage or carrying bags. First and foremost, I see this all the time when I travel, overloading of the bags. Avoid that if you can. Always try to balance your loads, so keep the weight distributed evenly as you can on from the left to the right. And in the ideal situation, we have these new wheelie bags, and we talk about kids down here and their book bags, and really, if I could do it, I would have every child using one of these roller book bags, but I have not yet to meet a child that thinks it's cool to have a roller book bag, so they all stick with their regular book bags. And when we look at those, again, it gives, these book bags have 2 shoulder straps for a reason. They're intended to be used. So slinging over one shoulder is the wrong way of doing it. Puts too much pressure on one side, doesn't balance the load. And then overloading is something I commonly see as well. As a parent, if you're trying to figure out how much weight should my children have in their book bag, no more than 10% of the child's body weight. So this is very easy to do. Stand them on the scale, see how much they weigh, put their book bag on them, see how much their book bag weighs, do the math, and that book bag should not weigh more than 10% of their body weight. Another thing that we see commonly is women, particularly, they'll come in and say, my neck's killing me on the right side, and I'll go ahead and I adjust them, and they get up off the table and they pick up their 10-pound purse and they string it right over top of that area that's irritated that I just worked on. Always avoid stressing the area of complaint when using any type of shoulder straps if possible. Let's talk about housework or yard work. Now, I'm not actually advocating that anyone watching this video performs housework or yard work. Obviously, if you have questions whether or not you should be doing yard work or housework, if you're capable of it, always ask me as a client and I can give you recommendations. If you do consider doing yard work, though, think about the following. We always want to maintain that good curvature in our lower back. So you can see we try to stay upright as much as we possibly can. We avoid bending at the waist, reaching movements, things like that. Another thing to avoid that's just generally not good for the spine is repetitive twisting movements. You want to avoid those if you can. Another thing that I talk with patients about I think is important is always spend an equal amount of time using the left and right side of the body. So someone will shovel snow or rake leaves all day long, always with the same right arm. And that's where you get yourself into problems, because you're going to overstrain that right side, versus taking 50% of the time and switching the shovel off into the left hand, or switching the rake off into the left hand, keeping as much symmetry and balance as you possibly can during the activity. Pushing versus pulling. Pushing is generally considered to be a safer movement than pulling. Again, when they're heavy loads, anything can be dangerous, but if you had a choice, you would certainly choose to do some pushing. And it's like anything we've already talked about. It's maintaining that good curvature in the lower back versus rounding that back out. Pushing is always more effective. How about using a back brace? There's a lot of kind of myth that kind of floats around there, I guess, about using a back brace. It is a good idea to actually use a back brace when applying greater than normal physical stress on the lower back. And you want to wear a back brace for short periods of time. So if I know that I'm going out for a half hour, an hour, or whatever the situation may be, to cut wood or load wood or something like that, I'm going to wear a back brace. I'm going to give my back that support that it needs, because I'm putting greater than normal pressure on the back. It's generally considered not a good idea to just wear a back brace 24/7, 24 hours a day, 7 days a week, unless you've been advised by your physician to do so. Wearing the back belt for extended periods of time, hours on end, day after day, can certainly weaken the core muscles of the lower back. And remember, those core muscles are what give your spine its stability. So we don't want to weaken the back, we just want to support it. So again, to finish up here, why practice good spinal ergonomics? Again, it's no guarantee, but it is good risk management in there. Do everything in your power that you can to maintain good health and functional status. That includes, in addition to good spinal ergonomics, proper diet, proper hygiene, proper health habits, staying away from alcohol and tobacco, practicing things like daily exercise, cardiovascular, strength training, stretching, etc., to help keep the body conditioned, and utilizing regular body maintenance professionals. These include chiropractic and massage therapy. Medical doctors are important too. I have a medical doctor, but on a routine basis, I'm visiting my wife, who's the chiropractor, and my massage therapist every few weeks at the very least, to kind of work the kinks out and to keep my body functioning as optimum as it possibly can. While this list that I went over with you is certainly comprehensive, it's not all-inclusive. So if you have any additional questions or concerns about ergonomics, or things that you're doing in the workplace or at home that may be causing some issues with your spine, please don't hesitate to ask me during your next visit, and we'll do everything we can to help you help yourself to get better quicker and stay better longer.